Good evening and thank you for joining us. With the August long weekend now behind us, a new and very different school year is fast approaching. Across the country, provinces have unveiled plans for getting kids back into classrooms, though many parents and students are still wondering how it will work and whether it's safe. In tonight's top story, Heather Yerkes West digs into the latest research on kids and COVID-19 and how public health officials are trying to manage the risks.
Send children back to class and risk infection. Keep them at home and risk their education or emotional health. It's a decision facing parents right now that appears to be no win. In Alberta, more than 6,000 parents have signed an open letter voicing concerns about the province's plan for getting kids back to class.
If you think about the fact that a lot of people have asthma, if you think about the fact that a lot of people have heart disease, if you think about the fact that a lot of children see their grandparents, all of these things create vulnerabilities from the get-go. And so it seems very difficult to simply say that we will just see how it goes.
Schools will be operating in uncharted territory, relying on research that is still incomplete, with new data emerging almost every day.
I think all these studies, a lot of them contradict each other, and so it does make it really confusing.
Last week, a study published in the Journal of the American Medical Association found young kids with COVID-19 carried more virus in their nose and throats than older kids and adults. But that may not mean kids are easily able to spread that virus around.
I think that little kids, children are not coughing as forcefully. They may not have as many symptoms, so maybe they're not really coughing as much.
In Australia, where schools remained open during the first wave, data published Monday suggests that when physical distancing and hygiene measures are in place, the risk of transmission is low. After looking at data from 25 schools between January and April, researchers found that although 27 children or teachers went to school while infectious, out of a possible 1,448 contacts, the virus only spread to an additional 18 people. Of course, there are social and emotional risks to keeping kids out of school as well.
What we don't want to do is then have a cohort of kids that have missed really important parts of their education, which are necessarily, for most of these age groups, building blocks for their later educational success.
It's why many provinces are determined to get kids back to class, even as what is known about the virus continues to change.
There is still a lot of evidence from international sources and other jurisdictions that we are carefully reviewing. Our guidance will be updated in the coming weeks when we complete this evidence review.
So though the school year is just weeks away, back-to-school plans could still change by the time kids are ready for their first day. Heather Yerkes West, Global News, Calgary.
More than 1.3 million Canadians have hearing disabilities. That's according to Statistics Canada. And nearly one quarter report they read lips to communicate. Now they're having to navigate a world where face masks are being worn to slow the spread of COVID-19. As Crystal Gomansing reports, the hearing impaired community is advocating for wider use of a special mask designed to help meet their needs.
Masks are a part of daily life in the UK, and Mangai Sutarsan is all too aware of the rules. Standing waiting for the moment someone speaks to her now fills her with dread. She says, for me, it's so important. It doesn't matter if I'm communicating with another deaf person or a hearing person. Lip reading is incredibly important. If someone is signing to me and they're not using lip patterns and mouth movements, it's impossible to understand. Sutarsan is the director of Empowering Deaf Society. She understands the importance of masks, but wants everyone else to understand how they and other face coverings are leading to millions of people feeling excluded from society.
It's created just not only communication issues, but very much mental health issues. There's a lot of angst, there's a lot of frustration, there's a lot of fear.
In an effort to address those feelings, the Canadian Hard of Hearing Association is looking to the federal health minister to advocate for wider use of clear plastic face shields. They remove the barrier for those who need to read lips while keeping people safe. There are also masks with clear panels. To raise awareness, paramedic Danny Hughes took to social media recently to show people how he's using his phone to bridge the divide.
That some of our patients and service users rely on lip reading to communicate. and wearing a mask makes lip reading almost impossible.
Zatarsin, like her Canadian counterpart, wants the government to advocate for more clear masks to be produced and used, allowing her to go back to doing regular tasks without heightened anxiety. Crystal Gamansing, Global News, London.